Good evening, everybody. Dr. Rao Garu, thank you for my new title. I'll treasure it. It's very special to me. It's a pleasure to be here. It's also an honor to be here. I belong to the film industry and I'm thrilled to be there. I can't imagine doing anything else with my life. I have been fortunate to meet many wonderful people, inspiring people, and one who has been a lodestar for me all my life. In addition to this, another group of people that I've always looked up to and for me are almost on another level have been doctors. I've been very fortunate to have two wonderful parents. My father was a radiation oncologist, my mother was a pathologist. And very warm, caring, grounded and very hands-on doctors who showed me a completely different side to medicine, healthcare and one's own life. And because of that, I'm so thrilled to be here because I see on this stage a completely new set of rock stars for me to admire and to respect. Just to name our star of the evening, Dr. Chandy. It's really an honor to be here and I'm just so glad I live in the same time. This is a medical conference organized by Yashoda Hospitals. By its very history and its growth pattern, it's very obvious that they've always pushed for cutting-edge technology to help in bringing the latest kinds of treatments and helping people. Healthcare, it's however much of a corporate or a business venture it is, at the end of the day, it is about preserving life. And in that, it is an invaluable service to society. I would like to congratulate them wholeheartedly and I wish them many, many, many great successes to come. This is a medical conference. What am I doing here? I'm a survivor, cancer survivor, yes. All of your doctors, various degrees of expertise, various areas of expertise. There's nothing that I wish to even add to this except to say I'm here as a layperson. I'm a representative of who sits on the other side of your table when you pass a diagnosis or when you talk about treatment protocols or anything else. There's been a lot of talk in a lot of events like this or even different where the medical profession themselves have been talking about raising awareness about cancer. That's a wonderful thing. But what I would like to say here is the responsibility for that kind of awareness rests with every one of us. If I as an individual don't take responsibility for my body, my health, my life, then there is nobody else who can be held responsible for that. There's nobody that I can point to and say, I am sick, why didn't you make me better? Or somebody close to me passed away because of cancer and why didn't you do something? I'm not saying that everything is curable all the time. A common cold can be devastating. Medical professionals, all of you know that. But what I'm trying to say is there are so many different angles to beating cancer, to having a wonderful, best quality life for whatever time that is that we have. And I would like to also talk about one other thing which I was personally very fortunate to have experienced, but I know is not very uniform, is more that is over and above your involvement with the patient, a doctor's involvement with the patient as a medical caregiver. There is a lot that the patient and their personal supports, their family and their loved ones need. For example, when I had the axillary clearance of the lymph nodes, I got a lot of information from my surgeons, from my radiologists, from everybody as to how I could prevent lymphedema, which is something at the end of the day, it's maybe in many cases it's a cosmetic issue, but it changes lives. It alters self-perception. It affects the way women look at their lives for the rest of their life. So because I got that kind of guidance before I even went in for my procedure, I was able to take a lot of preemptive steps, right from a certain kind of exercise and wearing certain kinds of compression bandages. I mean, there were so many different things that I was told. These I found talking with other survivors, people who have gone through these kind of treatments. Not all of them have had the advantage of getting this kind of advice in time. So I would like to say, aside from a lot of well-meaning individuals, there are so many NGOs who are doing so much of supportive and ancillary work. It's a sincere request from myself that as medical caregivers, doctors at different cycles from diagnosis to treatment to post-op and everything, I would sincerely request that it takes a minute extra. But if this were words that come from a doctor, they have infinitely greater value and greater credibility for a patient. And it would make the world of difference to the kind of confidence and the kind of self-control that they would come to the treatment with. And at the end of the day, as with so many things in life, it can very well be a question of mind over matter that actually wins the day for both the doctor and the patient. And with these few thoughts which I've been wanting to share for a while, I would once again like to say congratulations to the Yashoda Hospital's team. They're wonderfully dynamic, committed, passionate, and very, very progressive team. And this wonderful place that they are based in, it's such a pleasure and such a joy for me to be back here. And thank you very much again.